our session now is based up around harnessing public-private pharmacy partnerships in healthcare. So our panel members include Chris Lucolo, who's from UNCDF, who I don't see at the moment. So maybe the IS team may have to make him a panelist, because I'm not sure if he's made it onto the panelist group. Here in the room, I'm not sure if you can see us in the room, if there's a video of us in the room. Can that be streamed? Can the room be streamed on our feed? Is that possible? Because myself and Patrick Magisha are here. Patrick is co-founder and managing partner for Innovent Labs Africa. Patrick studied here at Makerere, so is an alumni at Makerere. Also has a master's from Southampton and also from Zimbabwe. He's recently left the Ministry of STI to move into the private sector. And as you can see, has various high-level positions in many groups, and we're welcoming him here today and grateful for him joining us. Haget is a global health practitioner who has worked on deploying technology-based solutions in over 20 countries. She's a New Voices Fellow for the Aspen Institute, co-chair of the WHO Digital Technical Advisory Group, and is working with a government-based smart village platform for Africa, and works with the Harvard Medical School executive program on digital health. Chris is the digital country lead for UNCDF, Chris Locoilo. He leads the UNCDF program on Nobody Left Behind in the Digital Era. And they really are working on this private-public partnership for a market systems approach to building a digital economy. Andrew Chambadi is the health system strengthening lead at USAID. He also has a master's from here at Makerere, and also went to Wales for his master's, as well as management studies at Uganda Management Institute. He's been with USAID for 20 years now, covering a wide range of different activities, and his current portfolio includes health system strengthening, working with both public and private sectors. So I believe Haget has prepared a presentation. I think if we could start with that, but we would ask you, and I'm sorry if this means running through your slides, but we could ask if you could limit that to a 5-minute introduction, because I think it would be really nice after all the presentations this morning for us really to have a discussion between ourselves. But Haget, you have the floor. And I'm really sorry if I'm not pronouncing your name properly. You may need to give us a lesson when you introduce yourself. Thank you so much.
It's okay. I'm a francophone in Anglophone who grew up in an Anglophone environment, so it's I'm used to having to give a lesson. It's pronounced Huguette, like Yvette, but Huguette.
Oh,
So I'm going to quickly share the presentation, and I think it'll be helpful just to walk through it. In fact. Is this visible to everyone? Is it possible for me to get?
Yes, that's right.
Thank you. And so I wanted to touch on an area of collaboration, which is good that I don't have as much time, because a lot of what I wanted to talk about has been shared. So my experience has been in developing and implementing digital solutions, and then also in recent years working on policy as an advisor to help organizations looking to expand in Africa. And I've worked in the private sector as well. And so some of what I'm going to talk about I'm learning more and more with time and experience the importance of really zooming out and looking at the whole situation. So some of what I'll talk about may not be directly linked to innovation and digital technology, but these are all the elements I think are required for us to really progress and leverage technology accordingly in the health sector. And by us, I'm speaking for the African continent, but also the world. I'm from Congo, so I say us, especially if I'm in an African environment. But first, I'd just like to thank you again for this opportunity to speak, and thank all the distinguished speakers and the panelists before me for what they've shared. It's so encouraging to be a part of these types of forums and continent-led initiatives. I think one of the responsibilities that we have as we're talking about universal health coverage or responding to the needs of our population is really to be able to get the care that we need to every single person, no matter where they are. I don't think anyone disagrees with that. And what that means is really also paying attention to these needs that are beyond just the needs of patients or populations at a point of care. And for those of us who are working on developing solutions, be it actual software, hardware, or programs, our value proposition must be always clear. We have to be really clear about what are we presenting and how is what we're proposing going to make lives better, and are being able to articulate that clearly to our prospective users. So the one thing I've been touching on recently, especially in this Smart Village project that I'm doing, which is expanding connectivity to hard to reach area, is the literacy issue. Many of us who are working with technology in the health sector, we focus on teaching people how to use the technology, forgetting that part of getting our populations to really care for themselves includes having the ability to read and write. And so this fits into the private sector environment. For me, it's because many of our education providers on the continent are small businesses, institutions who are also training along with the public educational institutions to work on that. The more literate our population, the more we're able to get technology-based solutions out to them, and the more they're able to access it and use it accordingly, so that we don't find ourselves in a cycle of let's teach them how to use this specific technology for this specific need, and then once we move on, they're back into the same position that we found them in. The other key variables, which has been touched on, is the need to also pay attention to our infrastructure in our projects, perhaps not just to look to people who can collaborate with us in the health space, but look outside of that and see who can we link up with to make sure that a road can be extended to. There was a question about how do we get technology to rural areas. Sometimes it's really a matter of actually physically getting there. Our prior panelists talked about the issue of power as well. We forget without access to power, none of this is usable to much of our population. So to think about, and the private sector they're the ones running these spaces. And so to open up our collaboration options to include them as well. And I might talk about the digital infrastructure a bit more in the Q&A or in the discussion areas, but what we're having to pay attention to increasingly, it's the cybersecurity, it's the data infrastructure, it's the types of hardware that servers, sort of ones that we can deploy in hard to reach places, so we can improve or facilitate transfer of information within a specific community or amongst facilities. So these are all the areas where there's private sector, the ability to collaborate with the private sector. And then the regulatory environment is one. I'll be done soon, Rosalind, but the regulatory environment is one. We tend to develop policies retroactively. There was a panelist who talked about really looking at and being clear on the problem that we're trying to solve, and then before we define a solution. And to me, part of the solution that we define, especially one that's working, is to also think about how is this going to be sustained. how does this fit into the existing regulatory environment, and what are some of the adjustments we need to make to ensure that this solution, if indeed it works, it can be sustained and continue to work in the way that we need it to work to improve the health of our people. And I see very little involvement from the legal community in the health space. And I think this is where they can be useful for us. And I can also talk about the financing a bit later when we have the discussion. The last thing, it's really sharing lessons learned. You're in Uganda, I don't have to tell you the impact of telecommunications. What they have done, if we were to sit down and think about it before it happened, it would have seemed impossible because of where we were in our infrastructure and also our behavior in terms of communicating and the ways we thought about using phones. And so it's important if we can have these discussions about what was their process, what did they learn, what are some of the roadblocks they face. Same with banking. We take it for granted now that I can travel anywhere in the continent, outside of the continent, and use my card to retrieve funds. It means I have access to my data. It means there's an seamless exchange of data between my bank in Congo and the banks of everywhere else. How did that happen? We're still struggling with this issue of interoperability in the health sector. And as we increasingly move towards the research space, increasingly move towards investing in robust research projects in collaboration with academia or small enterprises, these are some of the things that we could learn. And there are industries that have done it before us, so we don't have to start from scratch. There may be lessons that we can take from them. So these are some of what I wanted to share with you all this morning around ways that we can collaborate with private sector and to help us progress in health. So I'll pause here and then share more during the question and answer. Thank you again for your time.
Thank you so much. So I think we are going to go straight into the Q&A, and I'm sure if anybody has specific questions if they can put them in the Q&A questions, and if we have time, we will also ask these to the other members. So Patrick, I'm going to turn to you now, and I'm going to have, from your unique position moving from the public sector into the private sector just recently, can you give us your thoughts on what the benefits of the collaboration between the two entities are, and what you think informs a very strong public-private partnership model? What do you think the key elements of success are? Thank you
so much. Good morning, colleagues, all the participants, virtual and physical. Yes, I think I've already been introduced, but I want to briefly maybe talk about Innovent Labs Africa, the entity that I co-founded and in which I'm a managing partner. So this was an idea that for a very long time, I really knew it would come to life. And that's having looked at all the gaps that do exist both in the public and the private sector. So we summarized our existence into 3 pillars. That's innovation management, standards compliance as a key component for the innovation process, and last but not least, intellectual property value chain management. So that's why Innovent Labs Africa exists. Very rare indeed would you find an entity that has got a component of all the 3 in terms of skill set. So I think we have a chance to work together, and I think with the IDI and related partners, I think to be a good opportunity for us to see how best we can work together. So back to the question posed, definitely benefits are too many when it comes to where you need to partner. And I can give a small analogy. If I would send it back to my sister here, the benefits of marriage. Yes. Yeah, there are many benefits. So if you decide to remain single, there's something that you may not enjoy, like someone who's married. And of course, there comes benefits because at the end of the day, one partner could be coming from a less privileged family, marries a daughter of a rich man, he's also a rich person by association. So now it's the same way. Partnerships are always catalyzed by inadequacies or lack of equity in available resources. And that's why when we decide to focus on the health innovation space, number one, health as a sector globally is a very risky sector in terms of the demands that are required in terms of resources, that's money, human capital, and also the supporting or enabling frameworks that are supposed to come on board. On average, to get a drug from idea to the market, pursue the approval stages, it could take close to 5, 10 to 15 years. So really, I don't know what kind of commitment is that from a government to make sure that they want to take the risk and support an institution, maybe IDI and its academy, to be able to work on a program of that nature on drug discovery. I don't know how possible that would be. But since it being a risky venture, then there could be those potential partners who are willing to take the risk. And that's why at times, if government does not actually step in, that's why PPPs work. That's why we've got a legal framework in place in Uganda, the Public-Private Partnership Act of 2015, I think. And of course, that was important. And it was a very strategic direction that the government to take, because that presented where to create a platform where government has got maybe infrastructure resources, private sector player has got the money, they can come on board and decide on an agenda and they move forward. So the issue of scarcity of resources, it being a risky venture, for you to be able to access what you could not be able to access as one of the parties, it makes available for you in this kind of partnerships. But then of course, exposure and networking opens you up because again, taking you back to the analogy of marriage, if you could find that maybe in my family, one of my uncles maybe is the richest man in Uganda, why wouldn't you be able to access and meet that particular fella? It's networking. It opens you up. And then, of course, presenting other opportunities that in the past, maybe you could never access them. That presents the case. And so what would be the best model that we feel can actually strengthen the two approaches? Number one, of course, if the two parties do not outline their critical areas of interest, then there's going to be kind of lack of equity in how they partner moving forward. So party A will present their priority areas. Part B presents its priority areas. They have now to strike a balance. In a partnership, definitely there has to be where you decide to let go such that something can actually happen. So those are some of the approaches that you really need to get on board. And I think finally, why government sometimes, the innovation ecosystem, the private sector, you end up innovating, but then you realize that you're not actually working around what the legal frameworks requires. You may never achieve the success you did in the marketplace. So I think that some of the aspects you're going to reach out to and engage in the following discussions as we move forward. Thank you, President.
Fantastic. Thank you so much, Patrick. I think it would be great, Andrew Chambade, if we could hear from you. Would it be possible for you to give us an example of maybe your favorite PPP that you've seen with the USAID, and a brief summary of what you liked about that private-public partnership and what was great about it, Andrew?
Thank you very much. USAID USAID has supported private-public partnerships over an extended period of time across 2 programs. We did, for the first time, venture into supporting private sector through getting private sector to provide services beyond their catchment area. One of the best examples where we've had a solid PPP is where USAID moved in, went to one of these big plantation entities, told them that, you know what, you have 10,000 employees here, but you do have a big catchment area that doesn't have services from the private sector that's close by. Can we come in and work in partnership with you guys to expand your facility so that eventually the catchment area can come and access the services? And they did allow. So most of these plantation-based entities are allowed to have their service centers expanded, equipped, and have all the staff trained. That guaranteed the staff within the, that guaranteed the folks within the community catchment area to come and access the services for very highly subsidized rates, or even free in cases where, for instance, we provided malaria drugs, ARVs, and some kind of basic tests where we provided all the lab equipment. So that's one of the PPPs where the community has benefited from a partnership between a public setting and a private sector entity. Over.
That's great. Would you mind putting on your video so we can see you?
My connectivity.
It would be really nice, as we're not able to be together, if we could also see you as well.
My connectivity.
So that's a great example. We may come back to you for some more insights shortly. I'd like to just go to our last panelist, Chris from UNCDF. And Chris, my question to you is, Patrick has talked about health being a risky sector, but we know UNCDF is investing in this and encouraging other investors to work in PPPs in health. What is the UNCDF kind of view on the risk of PPPs, but versus the benefits of investing in the health sector for private sector organizations?
Thank you so much, Rosa. Let me turn on my video so I can say hello. I don't know if that's working, but it's good to be here, and thanks for having me. And thanks for a great question. Indeed, UNCDF in its work, and just to give colleagues some background here, the UN Capital Development Fund is really the only UN agency with a capital mandate, meaning that while various UN agencies help to achieve the SDGs through either humanitarian care or healthcare or food and agricultural practices, we do it through the deployment of various financial instruments, various capital instruments. And by the very nature of our work, public-private partnerships are very central to the way that we operate. And so for us, primarily in Uganda, so where I'm based, we are doing a lot of work to encourage the uptake and usage of digital platforms, digital service offerings to improve people's livelihoods and productivity. But in reality, many of the business models that we see are not always geared towards underserved communities. And so we try to work with different private sector entities to find innovative business models that are geared towards underserved communities. And many times there might not be willing investors, sources of investment for these more risky business models might not be existent. And so in providing de-risking financial instruments like grants, like guarantees, like loans, we're trying to unlock that. We're trying to show a case for these business models so that we can attract commercial sources of funding, the banks, the investment groups, and so on. And so that's the idea, that as we, as a UN entity, work with the private sector to innovate and find these new business models, we provide these de-risking financial instruments to make the case and show that indeed there is a ready market to be had in refugee communities, among rural farmers. But then in the process, we hope to attract, venture capitalists, banks, to be able to invest further in the scale of those successful solutions. And in the process, of course, we work with policymakers to ensure that the policies in place are enabling, so that underserved communities can indeed take up and use these digital innovations to improve their productivity. And so that's just one example taken locally from Uganda, from our current work, to show you just how public-private partnerships are working, in our case, to help to promote the uptake and usage of digital service offerings, digital platforms to improve people's lives. Now, indeed, there are risks, some being that many times when you have PPPs, the expertise, the level of expertise is not always matched. So the potential investor in the example I've given might not always know the local landscape, might not have in-depth knowledge of the market in which they hope to work. Similarly, the local company, the private sector company that's looking for that investment might not have the necessary connections, all right, to access the capital that they need to scale an innovative idea. The policymaker might not always have a good understanding of the business models at play. We all know that many times policymakers have to play catch up when we have new innovations. And so that right there tells you there's that mismatch that poses a risk, in the sense that you might not always be able to reap the benefits of PPPs right away. So there is always the need for managing these partnerships, for relationship building, for capacity building between partners, for also management of, there is a learning curve that before a private sector entity can access financing from a commercial source of funding, that there is a need to learn what this business model is about. As a UN entity, we also need to engage with end beneficiaries, that indeed, as we match make, that we are not prescribing, but instead talking to end beneficiaries and understanding the needs that they have, so that these new business models are actually solving real life problems. Indeed, the benefits of PPPs is as I've described, many times, especially in healthcare, I think that many developing nations, low-income countries might benefit a lot from donor funding, might benefit a lot from aid, but it's through PPPs that I think one can really see the opportunity for sustainability. As I've mentioned before, the work that we're doing, even in healthcare, it is, again, the primary goal is, yes, to deliver quality healthcare, but it is through that you find innovative business models. And if you can find interest from the private sector, indeed, somebody can make money from this, then there is a chance for sustainability, because once there's a viable business model involved, then there's a chance that this can carry on beyond donor funding, beyond grants, and actually be able to sustain throughout, beyond sort of the immediate resources that are available. So, I'll stop right there, but that sort of, hopefully that gives our colleagues a sense of some of the risks with PPPs, but actually some of the benefits. Indeed, as we see greater chances for sustainability and the building of capacity within different communities and governments, and indeed the chance to sort of extend the benefits beyond the life of, whether it's donor funding or grant funding or whatever it might be. Thank you so much. I don't know if you can still hear me, but
and Hubert, we enjoyed your presentation, but I wonder if you could pick one example from us from all your work where you've had a real success story with a PPP that you can tell us about briefly.
Yeah, sure. This is a recent one. Well, I can say, one is a broad example, which is so Africa last year, we received our end of polio certification from WHO. And I was, sorry, something dropped in my office. I was part of setting up the task force that led that initiative. And that was a PPP example. But one that I wanted to talk about now, as we're talking about underserved community, is the Smart Village platform that I'm working on with the International Telecommunication Union. And so they are they're invested in helping with getting connectivity to hard to reach places. And they're not doing this work themselves. The project I'm working on in Niger at the moment is that, so with Niger has a national agency for innovation, and they are the owner, the project owner. With them, ITU has coordinated coordinated between various private sector entities who have come in to bring connectivity. So we have VSAT technologies installed currently in 10 villages. And each of those are done by private sector entities. And then locally, there are telecommunications company that we facilitated collaboration between them and these entities that were bringing in the hardware, which they could use to bring the connectivities. So when that's established, the community is using that to get connected to the internet. And many of them already had phones and they were already paying for data, and now they can do a bit more. But we're not leaving it there. There's the NGO sector. So currently there's an NGO that provides a program primarily targeting identification of childhood illnesses. And so they've put in their mobile application. They've conducted the training for healthcare workers on how to use this diagnostics aid for the first time ever in a country where there were maybe less than 10 cases of cholera, reported. In 1 month, there were 40 cases identified with the use of this diagnostics aid. So the system, the Ministry of Health established its system, but without the aid of connectivity, without the aid of technology, they were missing a lot of children. And so that's one. And then we've got another private sector entity. So what in these rural areas is that transfer of data is a big deal. And we know that building a server farm in the middle of nowhere in Niger at this point is not yet feasible. And so a Kenya-based company that builds mini servers has come on board as part of the platform, and they will install their platform in all the communities where we have connectivity, so that when the health workers, for example, I'll use the health space, needs to transfer data to the district health officer, there is a way to do that within a localized network. Rather than having to use the bigger established national network. So that's one example where it took a long time. Chris mentioned how long these investments take. It required a lot of patience. I found myself being sometimes the therapist, sometimes the mediator between the various partners, whoever is leading it. And it requires a very high level of patience. And of course, the return on investment isn't clear. So the companies that are investing, the private sector, for example, that came to invest, there are several investing in this in terms of connectivity, or even those funding the health aspect, are people who worked for oil and gas companies, for example, right? So they're used to bringing resources to these hard to reach places where the return on their investment isn't really clear. So it's about looking at the profiles of company, and that's what I mean in terms of what can we learn from others. For this project, we looked at the profile, who's worked with a company where coming to a place like Niger wouldn't scare them. And we thought if people can go out to oil rigs and set up connectivity there, or they can go up to very rural or dense jungles and set up connectivity there, coming to a place where they can at least get to easily by road may not be so scary. And it turned out that it was right. And it's about looking at the profiles of the various companies in order to set up and it turns out one of them is actually expanding and helping us set up a connected clinic in an area between Burkina Faso and Niger, which is an area that has over 20,000 residents, but have been without any type of health facility. And so, but it took, again, a year of negotiation, a year of guidance. What was helpful was to have this national entity as the owner to help guide everyone, have the UN entity as the mediator to sort of host and bring everyone around the table and ensure that there's, everything is being responsibly, ethically done and being built for sustainability. And then having the private sector entities willing to take the risk and deploy these projects. Over.
Andrew has been our most quiet participant, so I'm going to give him the last question of the session, unless some come up in the Q&A. So Andrew, just to go back to you, how do you think that PPPs can help us with future health needs? So how do you think that PPPs need to evolve over, in the post-pandemic era? And what do you see happening in this space over the next kind of 5 to 10 years, maybe in Uganda specifically, but the greater region?
Right now, the development partners have an increasing willingness to work and support private health sector, because that is the easiest way to sustain the current services that are heavily dependent on donors. So for me going forward, I think PPPs is the way to go. For instance, one of the best ways through which you can improve access and quality of services is trying to make sure that both the public and the private work together. A big portion of health clients in this country will first make contact with the private sector. So the earlier the public realizes that the private sector is a critical ally in improving access and quality, the better. There's the issue of mistrust and suspicion that has been on between sectors. But I think COVID, for the first time, has forced the public sector to appreciate the fact that they can't live without the private sector. In this country, the private sector played an extremely critical role in trying to keep the system leaping through these difficult times. So just imagine if that relationship had been built over a strong foundation earlier on, how easy it would have been. But both sectors kept accusing each other that this one is not doing this, this one is not doing this. The other issue, the private sector has realized that the upper income markets are saturated at this point. So the private sector is now recognizing the need to get to the lower income markets as their next growth frontier. That's where the big numbers are. That's why they need to provide subsidized services with the hope that they will benefit from the bigger market out there. I think that's it. Private sector is the way to go.
So we're just ending the session. I know Ernest has got a question. While Ernest is saying his question, I wonder whether all my presenters could maybe put on their videos, and maybe in the room we could have myself and Patrick, and on Zoom we could have us all together, because it would be nice to have a little screenshot of us together. So Ernest, over to you while we're turning on our videos. Please give us your question, Ernest.
Well, it's actually more of a comment. And I think one of the things I think we're seeing right now on the African continent is a lot of these deals taking a lot of time, taking a year or more, moving from, the initial conversations to finally when something moves forward in terms of implementation. And to me, I think we need to really think about how do we radically re-engineer some of these processes so that procurement can happen a lot sooner. And there's no reason for it to take as long as it takes. But what we found is, I believe, if we don't actually invest in this as a problem, we look at and say, why is it taking so long? Look at the current steps and how can we make it a lot fewer steps, will not solve it. And if you look at, for example, countries like Rwanda where I can go there and within 3 hours have a fully operating company with bank accounts, etc. And by the way, in Rwanda, it was my cab driver offering me to take me to open a company, right? So it's that level of sort of buy-in and awareness across the whole country. Everybody's geared towards, we are open for business and this issue is important to the country and we want it to work. So we're going to remove all the barriers that you have. So it has been done in places where, by looking at the problem and consciously saying, these are the obstacles that get in the way of innovators. These are the obstacles that get in the way of investors who want to come in. We are going to actively remove those barriers. We're going to make it super efficient and fast. This is something where I think there's nothing stopping African countries from being the most enabling environments for innovators, both locally and globally. And just say, we're going to do it. Create a task team that's going to look at, almost like cleaning up all these kind of bureaucratic things we have in the way of things that we actually need, and then making this environment one where not only do we massively encourage our local innovators, but we make it easy for other innovators to come in and set up shop, create jobs, transfer skills, etc. But this kind of, I think, very traditional mindset of, no, you must come in, it takes you 6 months to get a visa, and then to license your company takes another, 9 months. It's not going to work. We're all going to be dead. We're lucky, in fact, COVID has not been more lethal than it has been, because we'd all be dead by now, right? If we kept on with this kind of approach. So we have to figure out how to get this to be done a lot faster. And there's no reason why we can't.
Fantastic session. I've really enjoyed moderating it. So thank you to all of you. I just wish we had longer, but that's always the case. I hope that this is the start of a conversation, and certainly not the end of a conversation. And I think maybe we need to have a forum where we discuss this in a bit more detail with the group around the table and the wider team. To your point, Ernest, we will be trying to put a policy brief from the conference together, that for our website, but also to be shared with our partners in Uganda and people like the WHO Innovations Hub. And I think your point on the enabling environment is well heard, is something that we'll take forward. So I thought it was going to be the last word. Patrick would like to have the last word, so I will give him the floor to close us off on this session.
Yeah.
Okay. Absolutely, you're here in person.
Exactly. Yeah, so just maybe to try and add some more flesh into what my brother Ernest is talking about is honestly, having had the experience to work in the public sector as a policymaker and now moving into the private sector wants to run, but the public sector wants to walk. So you have to really, again, I mean, why would maybe one officer fail, not maybe in his real sense of mind, slow down a process? Give them the benefit of doubt. Maybe they do not understand what innovation entails, right? They may not be understanding that. So I think at the end of the day, also the aspect of awareness, just to the public sector officer or policymaker. What's innovation to them? How do they perceive it? It's very important when it comes to negotiating this kind of partnerships. Thank you.
Yeah. Thank you so much. So please, can we give a virtual round of applause to all of our speakers? You'll be able to hear it in the room. We're really grateful for you joining us. Like I say, we could have talked about this all day. I could have quite happily stayed on the line, but I will get into trouble from my colleagues. But it was really nice to meet you all virtually, to see some old friends, and we look forward to continuing this conversation. Let it not be the first. Thank you so much. Thanks.